Today, we will be learning about vomiting and regurgitation. First, let's talk about vomiting. Vomiting is the reflexive, forceful expulsion of parts or all of the contents of the stomach and the proximal small intestine through the mouth. Vomit originates in the stomach or upper part of the small intestine. It is typically preceded by other signs such as nausea, excessive drooling, retching, and forceful contractions of the abdominal muscles. While on the other hand, regurgitation is the passive expulsion of food and fluid from the oral cavity, pharyngeal cavity, or from the esophagus. There are two types of vomiting. First is the acute vomiting, and second is the chronic vomiting. Acute vomiting is when a dog has been vomiting for only a short time, less than 3 to 4 days, and no other signs are present. Possible causes are access to garbage or poisons. Chronic vomiting or long-term vomiting occurs more than once or twice daily, and vomiting accompanied by blood, abdominal pain, depression, dehydration, weakness, fever, weight loss, and other signs. For the causes of vomiting, one of the most common reasons dogs vomit is dietary indiscretion or ingesting non-food items, and ingestion of toxic or poisonous substances, and some are caused by diseases. On the other hand, regurgitation is caused by a disease of the esophagus and is either the result of an obstruction or a motility problem like esophagitis. How does vomiting works? The vomiting reflex begins with the stimulation of afferent receptors located in the visceral organs by acute distension, irritation of the small intestinal mucosa, hypertonicity, acute erosion, and chemical irritation. After stimulation, these afferent impulses travel through the vagus and sympathetic nerves to the vomiting centers located in the medulla. The vomiting center receives input from the chemoreceptor trigger zone located on the floor of the fourth ventricle, from the vestibular system, and from the higher centers of the brain. The chemoreceptor trigger zone mediates vomiting secondary to drugs and toxins. The vestibular system is responsible for vomiting associated with either vestibular disease or motion sickness. Vomiting is divided into 3 phases. First is nausea, second, retching, and third, vomiting. During the nausea phase, the animal will have increased salivation and subsequent increase in swallowing frequency. This serves to coat and protect the esophagus from the acidic gastric contents. The second phase, which is retching, consists of forceful abdominal contractions. These contractions create positive intra-abdominal pressure and a negative intrathoracic pressure, which serves to move food towards the esophagus. The process is completed by forcefully expelling the vomitus out of the mouth. Contractions of abdominal muscles and the diaphragm provides the driving force needed for this to occur. How do we diagnose vomiting? Careful history taking, description of the material expelled, and the relationship of the episode to eating or drinking should be determined. Abdominal imaging like radiograph, esophagoscopy, ultrasound, and contrast radiograph to check for the abdominal content. Standard small animal profile like hemogram, serum biochemical panel, and urinalysis. In addition to that, special laboratory tests such as pancreatic lipase immunoreactivity for pancreatitis, bile acid for liver failure, and adrenocorticotropic stimulation test for hypoadrenocorticism. Fecal parvovirus antigen assay and abdominocentesis for peritoneal effusion may also be indicated. For the treatment of vomiting, antiemetic drugs are given intramuscularly, subcutaneously, or intravenously. Examples of these drugs are chlorpromazine, dolasetron, dimenhydrinate, metoclopramide, and euhimbine. Other drugs which are gastroprotective and prokinetic agents like ranitidine, cisapride, and omeprazole. Fluid therapy is important in the treatment. It is used to keep the animal hydrated, treat electrolyte imbalances and acid-base disorders. If the animal is not treated correctly, potential complications of vomiting include aspiration pneumonia, malnutrition, electrolyte imbalances, acid-base disturbances, and dehydration. Thanks for watching!